What is endometriosis? Why endometriosis occurs in women? How to avoid it? Endometriosis in the body is likely due to increased levels of estrogen hormone. But if the endometrial problem is happening, then it is difficult to stop. What is endometriosis? Endometriosis is a uterine problem in women. In this, the tissue inside the uterus grows and starts to come out and spread. It also spreads to the outer and inner parts of the fallopian tubes and ovaries. This causes severe pain in women. Especially when their monthly cycle comes, then the pain increases. This tissue is similar to the tissue inside the uterus, but it does not come out at the time of the menstrual cycle, due to which pain starts. Fertility in women may also be reduced due to this problem. Let us know why there is a problem with endometriosis and how to avoid it. Why endometriosis occurs in women. One cause of endometriosis is retrograde menstruation, in which the endometrial cells in the blood during menstruation usually do not exit the body but instead flow back into the pelvic cavity from the fallopian tube. These endometrial cells cling to all pelvic organs and start bleeding during the menstrual cycle. The second reason may be the transformation of peritoneal cells, also known as induction theory. There is a possibility of endometriosis due to changes in the peritoneal cells. In this, hormones like estrogen can convert embryonic cells at an early stage. When any type of surgery is performed, such as a C-section or hysterectomy, endometrial cells may stick to the surgical incision. One of the biggest reasons can also be a weak immune system, due to which the immune system is not able to destroy the endometrial tissues. How to avoid it? Endometriosis in the body is likely due to increased levels of estrogen hormone. But if endometrial problems are occurring, then it is difficult to stop, so reducing the estrogen hormone in the body can prevent the possibility of endometriosis. Actually, the lining of the uterus becomes thick at the time of the estrogen menstrual cycle. For this, the level of estrogen can be reduced through hormonal birth control drugs or contraceptive treatments, but these medicines should not be taken without consulting a doctor. Exercise regularly can also reduce estrogen hormone levels. Actually, obesity can also be the cause of estrogen hormone increases. In addition, intake of caffeine-rich substances should be reduced. Also, if you have a habit of consuming tea, coffee, or any other caffeinated substance, so leave it immediately, because caffeine-rich substances can also increase the level of estrogen hormone in the body. Apart from this, such women should also take special care of their diet. Exercise must be done for 40 minutes regularly, and a diet containing fiber and protein should be taken in the diet. What causes endometriosis mainly? The most frequent cause of endometriosis is retrograde menstrual discharge. During the time some tissue drains into other parts of the body, such as the pelvis, through the fallopian tube. Factors: hereditary. Endometriosis can be hereditary in the genes, as it happens in families. For endometriosis, endometrial tissue behaves like an endometrial tissue. With every cycle, it expands thick, breaks down, and bleeds. Although when this tissue doesn't get out of the body, it's bound. Cysts called endometriomas can develop with the endometriosis of the ovaries. There are 4 stages of endometriosis. The endometriosis is categorized into one of 4 phases: I minimal, E mild, E moderate, and IV severe, depending on the exact location. duration, depth and existence of scar tissues, and presence and scale in the ovaries of endometrial insects. Thanks for watching it. If you like this video, share it with your friends. Like it and subscribe to Natural Heal and Cure.